Linda on that.
Yep, and I have my name tag, right?
And I saw somebody else, Elizabeth.
I've got the key. Good morning. How are you?
Good morning, everyone, and welcome to the Southeast Region Inter-CHNA first annual meeting. I'm Ron O'Connor, the Southeast Regional Director for the Massachusetts Department of Public Health, and I've been involved with the CHNA since their inception in 1993. And some of you might be wondering, well, how is it after 20 years we're finally getting around to a first annual meeting of the Inter-CHNA? It's many of the CHNA, all the CHNAs are in the process of celebrating their own 20th anniversary. And the Inter-CHNA work has been going on for a number of years, very successfully here in the Southeast region. And we've had a number of conferences over the past couple of years, a lot of people, and we launched the Pathways to Prevention work of the Southeast Inter-CHNA last November by bringing together over 125 people to talk about launching a new era of collaboration among the CHNAs, health and human service providers, hospitals, community health centers, etc., towards improving population health. We were fortunate to have, for that conference, have collaborated with the community benefits officers of the hospitals in the Southeast region who provided support for that conference in addition to funds that the Southeast Inter-CHNA group had themselves. And as a result of that, as a result of the hospital support as well as Inter-CHNA funds, we had a surplus of funds which allowed us to provide this free breakfast today. So that's why there was no charge today. I dare say that you might not expect that always to be the case, but it's good to have this turnout. I looked at the list, and there's about 3/4 of the people who are here this morning were at that conference last November, so that's good. And our intent here was to continue the conversation and to do something an event that was relatively little work to convene, although I do have to acknowledge the great work that Marcia Picard and Marianne D'Souza did in leading this event and pulling everything together. Responsible for setting up the tables and arranging for the caterer, among many other things. And Andrea Ketty from my office, I'll acknowledge her efforts in handling registration and putting together the packets for us. So it's very gratifying to me, having been involved with CHNAs for 20 years, to see this kind of an event brought together, and now our fourth gathering in about 2 years. So our intent this morning, again, was to continue the conversation from last fall, and that conversation today will be about two things. One, how do we do better work at advocating? Because the Inter-CHNA group has talked about, well, what do we do besides have these gatherings and education and conferences, but how do we do things other than that? And advocacy and education around important public health issues is an important role that the Inter-CHNA group can play, as well as individual CHNAs can play as well. So our speaker this morning will be talking about that. And the other piece of today is a discussion about, well, where do we go from here? So it's a nice lead-in from what we'll be hearing this morning to talk about, well, what are some other kinds of things that we can do? This is good to get people together periodically to network and connect, but there are other things that we can do as an Inter-CHNA group. Before I introduce our speaker, I'll mention that Kathy O'Connor, the director of the Office of Healthy Communities and one of the key architects of the community health networks in Massachusetts, is unable to be here today. She's at a planning meeting for our annual Ounce of Prevention conference, which will be held on October 2nd. You have a flyer about that in your packets. And I'll note also that a follow-up to that conference, the day after that conference, there will be a statewide gathering of CHNAs. And you'll be hearing more about that within your individual CHNAs. Our speaker this morning, who's been an important partner in our recent work, particularly in our conference last year, is Andrea Freeman, who's the Deputy Field Director for the Massachusetts Public Health Association. She's been there for about a year, and prior to that she worked at the Massachusetts Trust for Reservations doing land conservation work statewide. So we're very very fortunate to have Andrea today. This evolved a little bit out of the work we did last fall, as well as a meeting I had with Toby Fisher, the director of the Mass Public Health Association, who couldn't be here today. There's a lot of other important things happening, but he said anytime we want to have somebody come down and speak from MPHA, they'd be glad to do that. So I think that's an important offer that we should seize whenever we have the interest in doing so. So without further ado, Andrea Freeman. Thank you.
Good morning, everybody. My name is Andrea Freeman. I work for the Mass Public Health Association, not to be confused with the Mass Public Health, not to be confused with the Mass Department of Public Health. We are a nonprofit organization that works doing advocacy specifically around topics of public health, and one of which, of course, is going to be advocating for funding for the Department of Public Health and for policies and laws and implementation and transparency for all the many different issues that affect public health in the state. And so I just wanted to recognize, I'm here with my fabulous new intern for the summer. Rachel Anderson is back there being the, I just wanted to get kind of a sense of kind of who's in the room. Who here is from a community health center? From a board of health, okay. From a hospital, from, let's see, a different, if somebody who's from a staffed CHNA, or some different organizations. Okay, what other kind of organizations are here? For Mass and Motion coordinators. Hi, Pauline. Good morning. What else? Social justice organization. Great. What else? The Y, fabulous.
Elder Service.
United Way, Elder Services.
Salvation Army, and also a coalition of health agencies, service agencies in this area.
Great. Any community health workers? Fabulous. Okay, and many hats. Some people wear multiple hats. Yeah, I know, right? And then anybody here? Another one?
I do faith-based community organizing.
All right. Yeah. With WIC. Fabulous.
Subsidized health insurance, BMC Health, and Medicaid program.
Excellent.
South Coast Regional Network to End Homelessness.
This is great. Wow, what a great note.
Mental health and substance abuse agency, but particularly tobacco prevention.
Oh, sorry, go ahead.
Healthy families.
Great.
Fishing partnership.
Excellent.
Healthcare for all.
Beautiful. Great. One of our core partners as well. Yeah.
Diabetes Association.
Diabetes Association. This is fabulous.
Drug-free communities.
Drug-free communities. Wow. See, they're so independent. I mean, there are a couple different umbrella types, but everybody's so unique in terms of their representing. Is there another one? Wow. Excellent. This is great. So I'm glad to find out where everybody's from. Is there anybody here from outside, kind of the southeastern Inter-CHNA regions? I know there's some folks working statewide. Okay. So I guess Rachel and myself are the only ones here from Central Mass. I actually live in Worcester. Rachel's from Worcester. Or I live in Leominster. Rachel lives in Worcester. But okay. So thank you. So if I pronounce some of the town names wrong, my bad. We'll try to move on from there. The whole main reason that we're doing this presentation here today is to, the overall goal is to try to encourage more folks, including all of you, that when the time is right, when the issue is important to you, that you will also be an advocate for issues that you believe in, causes that you believe in for your organization, for individuals. And so part of what we're doing, I wanted to do, is just kind of demystify some of the statewide political issues on Beacon Hill. And so this morning, let's just get it out there. Policy and advocacy, those are not dirty words. Words like power, politicians, I know they've come to have such pejorative, negative meanings, often with good reason, but at the same time, this is the world that we work in with regard to state policy. And the fact that nonprofits, whether you're an agency, whether you're in a 501c3, or maybe you're even a 501c4, that you can, and really you should be an advocate. And advocating is not the same is lobbying. I'm just going to talk about that a little bit. And so then in terms of, we all know that we have very busy lives in terms of what we're doing. So how can we actually be advocates efficiently, effectively, while also doing, our day-to-day work, which is often so overwhelming. I'll touch on a few problems and talk about the difference between problems and issues, and then a few of the little state house basics, and then I was going to pose a question to you all on what the issues, what the advocacy interests are for the CHNAs in the southeastern Mass. So kind of the why of policy advocacy. It's not just because it's, you hope to see your name in print or trying to get recognized for some reason. The fact is that we have a responsibility to be advocates because, one, elected officials do actually need our help. In the Massachusetts legislature, there's almost 7,000 bills introduced every session. And so picture trying to weed through all these 7,000 bills. Maybe if you're a representative or senator, maybe you did introduce a couple of them, and maybe you know some of the folks that you work with that they introduced some of them, but the rest of them, it's a stack, it's a huge stack, it's a huge database, and you don't know which ones are important. And then you really pretty much only have about 2 weeks in January to decide if you want to be a co-sponsor on any of these bills. And so picture 7,000 bills filed, right? And then there's the winnowing, the narrowing starts to begin of who's going to sign on to be a co-sponsor. And if a bill gets a bunch of co-sponsors, it doesn't mean that it's a sure thing, but it sure helps. And if a bill doesn't get hardly any co-sponsors, it doesn't mean it's going to fail, but it makes it a pretty tough row to hoe from that point on. So again, 5,000, 6,000, 7,000 bills every year. And the biggest risk to these is that they just get forgotten. So there's a couple-week period in January where a dozen phone calls, some dozen emails from constituents to say, hey, just like anybody ever had a big stack of resumes that they had to go through to find that needle in the haystack of somebody you want to hire, and somebody calls you and says, hey, there's this great person named Joe, there's this great gal named Cindy. You look for that one, right? Because somebody you trust told you that they were good, that it was worthwhile, saves you time, and if you find a good one, it helps you, and it saves you time. So it's kind of that same idea within the beginning of a legislative session of helping our elected officials know which bills are out there, which ones merit attention. Again, just kind of right from the start, just help them get some of the cream to rise to the surface, so to speak. And then the other big issue is that, we care about, we're in public health, we care about social justice, we care about, the underserved, we care about the disenfranchised. Politics, policy advocacy, it's all about who gets what, how, when, where. It's all that allocation of resources thing. So it's not, science related, it's not medical related, it's not health related. It's policy, but it has a huge impact down the line. And also, again, politics, the dirty word factor, but it's negotiation, it's using dialogue to resolve conflict, and I just don't know another better way to do it. Maybe arm wrestling, I don't know, maybe tug of war or something like that, but in the absence of another method, it's what we've got. And then it's really a question of, do we want to be in that dialogue or not? And then the ultimate reason, of course, is the actual impacts down the road, the positive impacts on public health. Ron mentioned, we don't have to ask people to not smoke in their room. I don't know how many years ago was it that we would have maybe had to say that. We talk about anything from food labeling to cleaner air quality. You name it. You guys know. You go back even just a few years and all the major changes that are a function of policy that have happened. So let's see. And so the other thing I just wanted to underscore that advocacy is not the same as lobbying. Does that make sense? I'm going to go into that a little bit more. But any questions so far? Okay. So advocacy, really what that means is for us to have advocacy, good advocates, it can be as complicated as you want it to be, but I'm not about I don't want people to be overloaded and baffled with information. It's as simple as getting good information into the hands of people who can make decisions at the right time, and for them to hear it from a messenger or in a method that works for them. And so the right person, the right information, the right time, and the right way. I mean, that's essentially, the key to being an advocate. That sounds simple. Figuring out what that means, that's kind of another story. Okay, so being an advocate, who here is from a nonprofit organization? An incorporated nonprofit. Okay. Who here is from a state or federal or local agency or municipal government? Okay. Okay, good. Let's see, academic institution? Independent business? Okay. Okay. So what I'm really speaking to here are for nonprofit organizations, and to some extent agencies as well. And so if you want to be an advocate, there's some key things that you can and can't do. And I just want to try to make this as simple as possible. And so if you work for a nonprofit organization, whether you're wearing your hat as an employee or as your own individual, because I'm a resident of Massachusetts and I live in Mattapoisett or I live in Leominster or whatever, you've got two different hats you can wear. You can wear your working hat, right, as an employee, and then you've also got your individual hat. And again, right now I'm just talking about when you've got your employee hat on, because as an individual, you can do whatever you want as an individual. But so, as with your employee hat on, the simple things that nonprofits are not allowed to do by law, by federal law, through the IRS code, is that you're not allowed to work for a specific campaign. Not for Senate, not for president, not for mayor, not for alderman, not with your employee hat on. Because the whole idea that nonprofits have income tax deductions, and that people who donate money to your nonprofit, they can take tax deductions. So that's the federal government's way of saying, yes, we encourage this mission-driven work you're doing, and we don't want you to get involved in these other political areas. So we're just saying, just don't get involved with a political candidate. And same thing, don't get involved with a political party, whether it's the Republican Party, the Democratic Party, the Green Party, the Tea Party. With your work hat on, you can't do it in that role. On your free time, representing yourself, you can do anything you want, right? And then also, the last one up there, the no remarks before clearing it with your organization, that's not a federal law thing. That's really more just kind of a, don't be dumb, talk to your boss kind of thing. But the things that you can do to be an advocate, which is not lobbying, it's voter education, voter registration. You can educate policymakers. You can partner with other people, organizations, individuals who can lobby. So there's a big difference between lobbying and advocacy. So advocacy and education are pretty much interchangeable. It's when we get to the word of lobbying that's very different. Okay, but can nonprofits lobby? Some, right? So nonprofits can lobby some. So when we're talking about lobbying, we'll go into that definition in a second. If you want to lobby, basically the first question to ask is, we use that phrase from what was that Watergate scandal book by Bob Woodward and Bernstein, where he said, follow the money, follow the money. Same thing too with lobbying, with policy, advocacy work. So figure out how is your position funded? Does anybody know if they're fully funded by federal dollars? If your position is, okay, you know that. Okay, so no lobbying. So you probably already know that. Anybody know if they're partially funded with money? Okay, so what lobbying can you guys do? Partial. Joe, what do you say? None. None?
We cannot.
Okay.
Department of Children and Family funding, can't lobby.
Okay. So there's other restrictions. So even if you're not fully funded by federal government, depending on what your other funding source is, they may have their own internal restrictions. So if you want to know if you can do any lobbying, follow the money, figure out where it comes from, what are the rules there. Some people that are partially funded with federal dollars, though, if the other part of their time is funded either with grants, with fee-for-service income, with maybe you've got donors, maybe you've got corporate sponsorship, that other portions of that money, that can fund your time to do proportionate amount of lobbying. And most mission-driven, most social service organizations, they don't need to do a ton of lobby. There's usually these very critical moments when they need to have their voices heard. So it's not that I'm proposing that anybody do a ton. I'm just proposing that when the time is right and you need to have your voices heard at the right time with the right person in the right way, that to know that if you can do it with your professional hat on. So the one thing, one, follow the money, and then two, you don't need to be a registered lobbyist if you're doing, as long as you're not doing 24 or 25 or more hours of lobbying in a 6-month period. And the most that we would ever be asking you to do is probably like 10 or 15 minutes, maybe in 6 months kind of thing. So it's not even close to what, and by that I mean making a call to your state senator or representative, sending an email, maybe making a visit. So maybe there's like 45 minutes, right? So this 25 hours, that's the tipping point from where people would need to be registered, to be a registered lobbyist on Beacon Hill, the State House. And then we already touched on the different funding. If you have a foundation funder or a different funding source that says, I don't care what, maybe the federal government will let you do it because we're not federal funding, but because of what we're doing, you can't lobby. So if that's the question, you just, again, follow the money. So there's direct lobbying, grassroots lobbying. Direct lobbying, there's 3 ingredients that you need for it to be counted as lobbying. There needs to be a communication with an elected official or their staff. There needs to be, that communication needs to cite a specific piece of legislation. It could be a bill, it could be an amendment, it could be a plan for a bill. It doesn't actually need to be already have a number on it or anything like that. It could be a plan for a bill. So that's a piece of legislation. And then it's also that you're expressing an opinion on that piece of legislation. So person, legislation, and an opinion. If you're just talking to the person, if you're just talking to an elected official about anything else, or you're just talking to them about a piece of legislation, but you don't share your opinion on the matter, that's not lobbying. Grassroots lobbying is kind of one step removed. Instead of talking to an elected official, you're talking to other people other than your members, other than kind of your internal network of who you work with, who you communicate with, but that you're talking to other people and encouraging them to take action on a specific piece of legislation. So again, you can send out information about, hey, there's this bill that's up for a vote, and you don't tell them which way to vote, you don't tell them what your opinion is on it, you just say, this legislation is up for a vote this month, wanted to make sure you know. That's not technically grassroots lobbying, but if you feel, in the spirit of the law, if you feel like it's suggesting everybody knows what you want them to do, that's in the gray area. But for the most part, without the 3 ingredients, the communication, the reference to the specific legislation, and a call to action, without those 3 ingredients, it's not grassroots lobbying. And same thing with direct lobbying. You need those 3 ingredients for it to count. So, any questions on so far? So I made a little chart here, because I know sometimes it does start to sound a little bit confusing. But so I made this chart here to kind of say which box are we in here, depending on how you're funded, depending on what the action is you're thinking about doing. Is it permissible? Is it definitely a yes? Is it definitely a no? And where am I in some hazy area? So in terms of education and advocacy being distinct from lobbying, so education, any suggestions on any ideas on what kind of education counts as the advocacy education that you do? What is it that you guys do that would be education but might be construed? Yeah.
Put out a piece, our organization put out a piece, I'm just telling people what was in the medical marijuana bylaw. We didn't tell them, how to vote, just what was in it.
So explain what a new law came out and regulations and explaining what's
Like
there.
before people voted, yeah, we just
Yep.
explained what it would be.
So it's about legislation. It's already been passed.
No, we did it prior. We did it
Oh, you
prior.
did it prior. Oh, okay.
We put out a piece of paper that just said, this is what they did.
Okay. So again, a piece of education, information. There wasn't a call to action. Okay, great. That's education. What else? How about relationship building? Oh, yeah.
Well, educating the legislators about a bill and just telling them the facts and not asking them to do anything. You can meet with them and you can tell them the facts. Why, what has happened in the past and what might happen in the future. That's all you can say.
Right. Any other suggestions or questions, or like scratching your head wondering if it is lobbying? Yeah.
So the situation she just talked about, that's happened, I know some folks that that's happened to, they've gone, they talked to the legislator, and the legislator might come back to them and say, so tell me more about that, and what would you suggest would be a good, they've had that happen, how should we be pushing this through or not?
So
Whatever.
they're
So
asking
that
you for an opinion.
they're asking your opinion on how they should vote or push it through or not.
Right.
So
And
does
so,
that
okay.
change it any?
So are you in a position that you can spend 15
I
minutes?
personally am, but
Okay.
this
But if
person, this was a friend of mine
Who
who
was maybe
partially
prohibited from
federally
lobbying?
funded
Okay.
program.
Then she could ask somebody else to do it. She could contact my office. She could contact, you. She could ask somebody else to simply pass on. Says, I can't respond to that, but I'm going to have somebody else.
So she needs to say, I can't respond to that.
Yeah.
Gotcha.
And that's
Do you have something in print form handouts, that just summarizes this that we could access?
Yeah, we'll get this on, we'll have this on our website. I apologize, I didn't
That's
have
okay,
copies
yeah,
of this.
just a
Yeah.
question.
Sure. Thank you.
Note taking.
Yeah. Yeah, absolutely. Be happy to. I've gotten calls from a Mass in Motion coordinator in somewhere in the North Shore. I can't remember exactly where, saying, one of our charges is, one of our work plans is to focus on, more bikeable, walkable communities. We're working on getting a complete streets bill. And in fact, our councilman asked us to, do the research on what a complete streets bylaw would look like, and so now it looks like it's really pretty much, it's going to happen, and so a bunch of people don't even know that this vote is coming up. What are we supposed to do? And I was like, and she said, we can't do any lobbying on this, but at the same time, we're charged with trying to make this happen. So it really is this kind of push me, pull me, issue. And I said, well, why not, here's an idea. What if you take a fact sheet about what complete streets are and, either email it or put copies of it in their mailbox or something like that? Because, it's education. It's not a call to action. It's not citing specific legislation, but it's the right time. It's good information, and it's to the right people. So that's why it's advocacy and education and not lobbying. So if it's the right time, you don't actually need to make that call to action. Okay. Yeah, so like you said, explaining impact of a given policy on your community, that's education. Taking action as a member of a coalition on your own time, that's a whole different, again, working on your own time, that's a whole different ballgame. Sorry. Going to do a quick little quiz on education versus lobbying. Reminds me of, on Dave Letterman where he does the will it float kind of thing. Will it float? I don't know. Okay, so we already did the complete streets one. If you give a fact sheet on complete streets education. Okay. What about submitting a press release and a photo about a Safe Routes to School event or program to your local paper? What's that? Is that? Education, absolutely. What about from your, after work hours, from your personal email, you send an email to a few close friends asking them to contact your mayor about the city's school budget? on your own time from your personal email. Right, which computer, which login account. So that's a trick question there. If it's on your own time, you're using your personal email, none of these things apply. You are your own person regardless of who employs you. And as long as it's on your own time, your own, address, your home address, your personal email, that your personal physical computer.
Log into your own email address on
From,
your office.
yes, very good point. Very good point. So like the idea of being out, not in your office, not in a state or city vehicle. Yeah, it's all about your own time and your own resources. What about on your, anybody here do any tweeting for their organization or agency? Any ghost tweeters out there? Okay. Nice to meet you. From your organization's Twitter account, you send a tweet on June 25th reminding people to vote in the special election. Education, because you're not telling them who or what, you're just saying it's a get out the vote effort, right? Get out the vote. Okay, you're at the State House to give testimony on a bill to expand access to healthy foods. Lobbying, absolutely. Okay, and so then that becomes a question. Like yesterday, we were in a hearing that lasted almost 5 hours on zoning reform. So that like kind of started eating up some of the lobbying hours there. Okay, so I just wanted to take a break from that. And also just kind of put this out there, the idea of, so what do we do with this information? We know that we can advocate/educate. We know that some of us can do some lobbying at the right time in the right way. But, we all have limited time, limited money, lots of demands on us, seemingly unendless needs in the work that we're doing. How are we supposed to take on this extra, like how do I know what I'm supposed to do? How can I be effective? How can I, she says it might only take me 15, 30 minutes to make an impact as an advocate. How do I know what is the right thing to do at the right time? And, but if you want to be involved in state level policy issues in the budget, without having to follow a ton of media outlets, without having to wander the halls of Beacon Hill talking to people and meeting with partners and stuff like that. I mean, is there anybody here who's got time to do that on their own? Yeah, I didn't think so. I didn't know what my answer would be if anybody raised their hand there, so I'm glad nobody did. But so my recommendation, if this is something that interests you or want to be involved, but you don't have a ton of time to do it on your own, that you get involved with the Mass Public Health Association. That's what we were formed back in the late 1800s to do, to be the voice on Beacon Hill for public health interests in the state. We're a small organization. We're only we're 5 staff. Thankfully, we have a handful of fabulous interns pretty much every semester, every summer. But a very small organization that focuses strategically on key issues. We're involved with other coalitions. So we're part of the Massachusetts Smart Growth Coalition working on zoning reform. We're part of Transportation for Massachusetts, working on the transportation finance legislation. And then we are the convener and coordinator of a campaign maybe you've heard of that's a statewide, our Act Fresh campaign to focus on healthy eating and active living. So these are some, and then every year, of course, we work on the budget as well. Not just every year working on trying to get as much money for DPH as we can. So some of our, if you want to get involved with us, if you want to learn more about the issues or make it easier so that you can be advocates, you can sign up and you can get our regular e-letters and email alerts. We're on Facebook, we're on Twitter. Some of our most recent accomplishments, things that a lot of you have been involved with, well aware of, worked on, over a decade of advocacy work to pass the state school nutrition laws just went into effect last fall. My teenager was not happy about it at all. I hear about it almost daily. This was tons and tons of behind-the-scenes work, and then now that it has been passed, it is being implemented. Even after it was passed, we worked a great deal on the implementation, because as you know, just when a law is passed doesn't mean it's all done. At that point, you want to work with the agency staff that are responsible for drafting the guidelines And even now, it's on one of our top priorities to be kind of be a watchdog of it, and to, if necessary, to do defense on it. So who wants to spend 10 years getting this passed, and then just because nobody's keeping an eye on it, seeing it roll back, and not having it again. We've also, last summer, we were thrilled to have the Prevention and Wellness Trust Fund was attached onto the payment reform bill that came through last July. And there's handouts in your folder about the Prevention and Wellness Trust Fund, the $60 million over 4 years. We're still waiting on and working very closely with the state on trying to get what the RFP will look like. And as soon as we know more, we will let you know. Our executive director has been appointed to the advisory committee for that. And they're still waiting for a few more people to be appointed there. And let's see, and as I mentioned, we pretty much every year we're definitely working on the budget, and that's actually why our communications and policy director is not here doing this talk, because the Senate Ways and Means budget came out this morning, and there's 3 days, Friday the amendments are due, so they have to go through this whole process and identify, what's been cut and how does this apples and oranges compare, and it's the kind of stuff I can't do it. I mean, I have no idea. This guy, he's brilliant. I don't know how he plows through all this stuff and identifies what to focus on in order to improve, funding and allocation and for public health. So that's what he's doing today and tomorrow and Friday. So then the other thing is, how do we decide which issues to focus on? Because there's a zillion different topics out there, right? I mean, it could be anything. I mean, there's so many different issues. We're not, if we were a huge organization, we'd be doing a lot more. We're not. We do what we can, and so all the more reason to be very strategic. Our board of directors is key in helping to choose those issues, as well as our policy committee. And then for our Act Fresh campaign, we bring together organizations from around the state, and we actually democratically decide what healthy eating and active living legislation or implementation that we want to work on. And I just want to shout out to Dave Weed, our fabulous cameraman, who he and Nancy Bonnell have been very active the past 3 years, representing Voices for a Healthy South Coast. They're on our leadership team for Act Fresh. And so that really, MPHA staffs that, but we choose the specific issues to focus on by consensus of the group. And our board always kind of holds its breath to see what the group's going to come up with and hope that it jives with what the rest of the organization is doing. But so these are just some of the logos of our leadership team members. And again, there's some regional groups like Voices for a Healthy South Coast, BUL Berkshires, and then there's some community, like just specific community focus groups like Fun in Fitchburg or Groundwork Lawrence. And then there's also some statewide groups, including Health Resources in Action, Healthcare for All, American Academy of Pediatrics. And so it's this wonderfully diverse team of folks. The folks from American Heart and Stroke, she's a registered lobbyist. She's on Beacon Hill all the time. And then you talk with folks from, Bold Teens in Codman Square, and they're an all-volunteer organization. So we're working with very different involvement levels, resource levels, skill levels, geographic focus. But it's an amazing group of people to work with. And we know that we ask that once we decide on what the issues are that we're all going to focus on as a group, it's with the understanding that they will each take action on these issues when the time is right. How we decide on what we're working on, it depends on who the group is that we're working. Is it our MPHA board, or is it our Act Fresh leadership team? But essentially we start out with thinking about, okay, what's the problem? What are we for? Who else cares about this? If nobody else thinks it's a problem, is it a problem? Maybe, maybe not. Going to take some more thinking, some research. So of course, that's where the research comes in to figure out, okay, what's at issue here, what's causing it, there's quick fixes, there's long-term fixes. In the case of, the Act Fresh campaign, that came about because this problem, several years ago, really came to the surface that the rising levels of obesity were just going up at rapid rates. And so, in public health, it's always the data and it's the evidence that point out, that tell you where those problems are that need attention. So we said, okay, there's a real problem with the obesity rate. But you know what, there's no one person we can talk to. There's no one legislature that we can go to and say, hey, fix this problem. It's this big, overwhelming problem that has so many facets to it. And so, so what are we for? We're for preventing it, right? Okay, but that still doesn't solve it. It doesn't tell you how to solve it. But we're for healthy eating. We're for active living. We're for making it easy to make the healthy choices. And then the other question is, what's the story that we want to tell here? The story is that, obesity and the issues associated with it, it reduces life expectancy. It raises healthcare costs. It reduces quality of life. And then, so the big question, who else cares about this? Well, Wise care about it. Mass in Motion cares about it. They came about because of it, basically. There's a lot of other people out there with similar values and concerns. So we found out through our research, we weren't alone in having this concern. So through the research, figuring out, okay, what's the problems here? What are the things that we can do something about? And there's things like, well, there's way too few grocery stores in Massachusetts. We're 47th out of 50th in terms of grocery stores per capita in the country. Who knew, right? I mean, especially, and guess what? Here's the big kicker that's not going to surprise anybody. They're not evenly distributed. And do you think it's the poor communities that have tons of grocery stores? Not so much. They're the ones. City of Lawrence, 70,000 people in the city of Lawrence, one supermarket. Yeah, I know. Fitchburg is another major food desert. Springfield, neighborhoods in Boston. It's unbelievable. That we're 47th out of 50th in terms of, for the number of people, the per capita number of grocery stores for people in this state. So, okay, we think that's a problem because we believe, easier access to healthier foods, is going to help people eat better. We also know that, hey, we know studies say kids aren't as active as they used to be, and so what are we going to do about that? We also know that communities don't have a ton of money to do additional things above and beyond. So that's kind of was our thinking for, coming at the obesity issue. Because you can't just say, okay, obesity is a problem, let's tell the legislature about it and boom, they'll take care of it, right? Not so much. They really need the advocates to do the thinking, the research, the strategy, and P.S., identifying solutions. So what I wanted to do right now is just I'm going to ask you to do a little assignment at your table. So if you don't already know the people at your table, to just introduce yourselves. But the question that I have for you is talking about the difference between problems and issues. And so in the situation I was just describing, the problem was obesity. Then the issues became down to, say, the grocery store fact, right? We found out we did the research, there's so few grocery stores. As a result, we're working to pass a piece of legislation that would provide a trust fund, not a trust fund so much, but a fund, a Massachusetts grocery store fund that would provide low-interest loans and grants to get more stores either expanded, either corner stores have expansion so that they can expand, have more refrigeration services, that they can, or to build new stores in places where there just aren't any. So that's taking the obesity as a problem, drilling down, knowing that there's a zillion different aspects to it, but the legislature, they can't do anything about it unless there's something specific we can ask them to do. Because when we talk about problems, whether it's homelessness or crime or poorly performing schools, those are problems that are overwhelming, complex, multifaceted. We all want solved. None of us can solve them individually. But then that's where the strategy work comes in to identifying what some specific issues are. And so just as one as a kind of a get-to-know-you thing, but also as a way to kind of understand what's fascinating but also challenging about advocacy work, I just wanted to have you guys, I'm going to give you a couple problems and then have you come up with some of the issues or the strategy, solutions, strategies. One of them, there were three different ones. One of them was a seemingly simple one, litter. You know, the snow melts, got litter everywhere. Okay, litter, pervasive. No one person's fault, right? Not a huge problem in the grand scheme of things, but just one to get you started on it. And then the second one was going to be texting while driving, right? And then the last one, this is one of these overwhelming issues that we just, what do we do? What do we keep doing? Is that, you know, that of racism. And so I just encourage, one, you know, if you don't know each other, introduce yourselves, and two, just kind of come up with 2 strategies for each of these 3. And if you find that you just get focused on one of them, feel free to stand. I'm going to give you like 10, 15 minutes to talk.
That's the problem.
Paper, plastic.
The only thing that I've heard about litter
Well, what they're changing though now is you couldn't be on the phone or you got to be doing something else wrong, but now they can pull you over for texting. And it's a big fine now. Let me tell you.
Well, and I think it should. Yeah, I really think it
Some
should.
states just using the cell phone, you're pulled over.
Yeah, New Jersey.
But it always seems to be in just certain areas.
Yeah.
And as you drive around on the highways, you see all the trash that people have thrown over fences
Right.
or whatever, and it's like, okay, can I climb that fence? Take a bag. I think I could live that way.
I think like within a mile radius of my house, I have access to like 4 different grocery stores. I have Canford's, I have Shaw's, I have 2 Trukey's.
And Market Basket is coming down the street.
Oh, then Market Basket,
Market
yeah,
Basket is there, Walmart is coming down there.
Walmart, and then on 44 there's Shaw's and Stop and Shop, and even Target, and I'm like, yeah, so I mean, I have so many, that's strange to me.
And
Yeah.
these Walmart, they're supersizing. They're all becoming, you know,
Food
they're all getting
stores,
down.
yeah.
I don't know, I don't understand how that's really.
Well, water bottles.
You know?
Oh, no.
Yeah, water bottles. And what about racism?
I think that's enough on that.
And now I think we were going to have some problem with placing trash barrels places because of the terrorism. I mean, really, that's going to be a blowback on that. That is. But I agree that that is one way that I think
We're getting into strategy here. Did she say we could come up with some strategy?
Two strategies.
Because, well, maybe an issue is like dispensing of the trash, not just bags, but like most cities and towns now have big cutbacks in public works. So I wonder if they had bags there and had like maybe one large receptacle or something, or a few larger receptacles where you could sort of, we've adopted a park in Fall River, and one of the things we're trying to encourage people to do, I don't think anybody's actually done it, is we have trash bags available at the front desk. And so if employees feel so walk to the park. Excellent!
We just need a little funding.
I would expect nothing less than
We need some funding to first, study the issue.
it's all the isms.
More studies, right? More conferences, more white papers. More money. Oh, shoot. I really thought I was going to believe you guys. What about you back there?
Far more mundane. We did utilizing litter for other purposes, as they do in supermarkets, where they push the idea of not giving you plastic bags, but buying a green bag instead that you bring back, and so you're trying to train people while increasing your profitability at the supermarket. So it works out as a win-win. And identifying it as a public health issue. And another one was a litter patrol, kind of like meter maids.
So then who would you need to, who would you be asking to make those things happen? Who would you need to convince for, say, the litter patrol?
That would be a legislative issue, wouldn't it?
Either municipal, at the municipal level?
Yeah.
I think the town of Concord just outlawed plastic bags. Does it?
Plastic bottles.
Single-serve plastic bottles, okay. City of San Francisco.
The issue, of course, if it comes up with something like that, though, goes back to your whole idea about the supermarkets, that you're doing it in a selective, some communities have eliminated homelessness by just shipping the homeless out to another town. So that's always an issue.
So we talked about literature, we kind of got some kind of investment in solar compacting units. So that, because, open trash cans, and even the ones with the swing lids, they get filled up, nobody comes and empties them. And so what was, a good idea becomes part of the problem because the litter all falls out. So having some kind of solar compacting units that would...
Yeah. We were actually discussing those. Those are from a company called Big Belly. And they go a step further even. They have solar panels on top that power the compactors. But they also have a PDA system set up. So now the waste disposal people in the city have a handheld device that notifies them when the bins are full. So they only have to empty the bins that are full versus visiting every bin in the city every.
I love that.
And their technology is pretty amazing. But we were talking about some of the positive reinforcers. The gentleman back there mentioned like bring your own bag. There are some grocery stores that will take a dime off your bill for every bag you bring. You could do the negative reinforcers. There's some grocery stores that charge you an extra dime a bag. But we talked about, I don't know if anybody ever saw the videos, I think they were from Europe, the garbage cans that made the sound when you threw stuff into them. So they set up a camera on this garbage can, and there was a little kid, you toss the bottle in, and it'd make like a, Wile E. Coyote, like a... and it was incredible because what you actually saw was the kid looked for another piece of trash to throw into the can. And you had all these kids running all over the park picking up trash and throwing it into this can to get this noise to repeat over and over, so like positive reinforcers, right? Versus like negative enforcement mechanisms.
So again, the goal here wasn't to try to identify solutions for solving, litter. It's probably not at the top of our list necessarily, but it was to, apply that concept of, what's a problem, but what literally can be done about it? What scale do you solve it? Do you do the positive or the negative approach? What, money, who's going to pay? Who's the decider or deciders? And the pros and cons of all those things. And that's taking, a big problem, such as, homelessness or poverty or racism and drilling down instead of, throwing up your hands and saying, I can't do anything about it. Sometimes it leads to, again, more, sometimes it needs more study, more research, more conferences, more discussion, more dialogue. And other times, that's just kind of like where we as institutions sometimes get too stiff in those issues. You know what? We know what these things take, and so now it needs political will to make those changes happen. And so that's where when you folks start focusing on issues, that's where there are things like holding people accountable. Those are deadlines, there's dollar values, there's specific actions to be taken, there's specific things to be enforced. It doesn't always mean there's going to be a new bill to be introduced. It might mean enforcing something. It might mean defending something. It might mean raising awareness about an existing law, raising attention to an issue. So that's just, I just wanted to, just have that, one, to give you guys something to talk with each other about if you don't know each other, but also to apply that thinking of from an overwhelming problem. Is it something that, do I want to stay involved in the research and the talking and the writing about it? Or at what point do I feel like I'm comfortable enough with the information and wanting to make a change and be involved in the advocacy more? So, yeah.
I was going to say so I work for Drug-Free Community Coalitions, and there's an awesome website. It's called CADCA, C-A-D-C-A, and they have this kind of thing laid out in a really easy format where you can just plug in and have your community, have a discussion with a coalition or place that you work at or whatnot, where you can have this discussion and kind of lay out, because the issue, it's www.cadca, C-A-D-C-A, and I think it's .org, but they have all these templates up there And they kind of talk, they do like free trainings on there too. There's some that are paid, but there's some that are free. But just to talk about how the issue might look different for every community, like trash for one community might be a totally different root cause for another community, you know. But it talks a lot about that, so it's a nice resource.
So thank you for sharing. Thank you for sharing that. Because the whole other, if you want to go kind of upstream, or downstream of figuring out what the issues are that are going to be most important, that's where community organizing, partnerships, coalition building, we're coming together a couple times a year to talk and learn what each other are focusing on, to come together and find out what the shared issues are. Because if there's an issue you want to solve and there's nobody else in the room that cares about it, cares about it deeply, deeply enough to take action on it, chances are it's not really going to, be happen. But if you can find a group of people, a group of organizations that also care about it, it's harder to do it in the bigger group. We all know, right? The more people you work with, the more organizations you work with, the harder it is, and the bigger the impact you can have. So I'm going to wrap that up there. I've got, if anybody folks want to talk more about, some of the state house basics and all of the different ins and outs of that, I'm happy to individually, but I think we've done plenty for here today. And I've been asked to invite you all to partake of brunch. It's in the same convenient location as breakfast. And so we're going to take a 15-minute break, Ron? Is that?
About 10 minutes.
10-minute break.
About a quarter of, yeah.
10-minute break. Okay. Thank you all very much.
We need to go for a walk.
My name is Anne-Marie Sharkey. I'm an employee of Partners for a Healthier Community, and my friend Brittany will be coming up on stage. We're going to leave you in a very brief stretch break, just so you can kind of I think of my nephew when I get your sillies out. I don't know if anybody has any young kids, but there's a song called Shake Your Sillies Out. So if you want to stand up and just join us, you can feel free. If you need to modify any stretch, feel free to do that. This is just about feeling good for the rest of the morning. Did I say this is Brittany?
Yes.
I think allergies are really messing with my head. Okay, so we'll just start with a couple of deep breaths.
If you can't breathe through your nose for allergies, that's okay.
So just in through your nose if you can and out through your mouth. Feel free to let a groan out if you still have some morning groans. Don't forget to keep on breathing. That's a really important part of living.
Passing out on us.
We'll just bring these a little faster over. You guys look great. Keep our arms across our chest. Stretch out that arm. Your arms straight. Hold your elbows. Take another deep breath. And how about now for the breath? Now we'll just do some smaller twists with your upper body. We'll bring your bottom half into it now and just take a little march. You can feel free to dance break if you feel a little of the
We can do that on stage if you would like us to.
We have one stage.
Yes, but I hear.
Okay, we've lost the microphone, but we are reconvening our meeting, our first annual meeting. Where do we go from here? And I'm just going to fill in a little bit of history of the Inter-CHNA work. It goes back to the early part of this century, actually. It's not going to be that long a story, trust me. But, when then DPH Commissioner Coe said he wanted to know what's the relationship between the DPH regional office, the CHNAs, and the regional, at the time, the prevention centers, and local health. And so we convened this group called Synergy, which did some early work in exploring those relationships, and then it sort of took a back seat for a while, and was reconvened primarily under the leadership of the Regional Center for the Southeast Center for Healthy Communities, to pull together the CHNAs primarily to talk about those relationships. And you know, we're fortunate today to have Andy Robinson here, who was one of the Southeast Center for Healthy Communities staff who led a really strong and powerful group of CHNAs that are working together, first to build that network of those relationships among each other through these conferences and workshops that we've had in previous years, but now there's been conversation among the Inter-CHNA liaison. So let me talk a little bit about how the Inter-CHNA group is structured. Each CHNA has appointed, designated, otherwise someone's volunteered to serve as the Inter-CHNA liaison or liaisons for each of the CHNAs. So if I could have those liaisons stand up now, that would be great. I know there's more than just a few. Some are already standing. They're in the back. The Inter-CHNA group meets monthly on the third Thursday at 2 o'clock in a classroom here in this building, and now's a good time to express our appreciation to the Lifehouse Church for hosting our meetings here and for hosting today's event as well. I think it's a convenient location for us. Certainly this is a beautiful facility for an event of this size. So that's how we've come to be where we are today. The group has been meeting, doing a lot of conference and event planning, and the conversation among the liaisons has been, okay, now what? What do we want to do next? What kinds of things can we do as a group and as individual CHNAs, particularly around advocacy and education? And that's why it was such a great thing to have Andrea here today. And just another round of applause for Andrea's fine presentation this morning to set the stage for what we want to talk about here today. So I'm not going to talk much longer. I think we want to have some conversation about thoughts about what we want to do next. Are there issues that of importance to you as an individual or within your CHNA that you'd like to explore further, that we can develop? There's been discussion about position papers or letter writing campaigns or white papers, things of that sort. So I'm just going to open it to discussion. I think that's what we decided that this part of the meeting would be about, and we'll adjourn at 11:30. So I'll just put it out there. Questions, comments, thoughts?
Our coalition is, the Middleborough Area Assistance Coalition is currently working on acquiring our 501c3. So that's top on our list right now as perhaps some direction. We're working with Stonehill College right now, Georgia Antonopoulos, and she's been quite helpful. But grant writing, I think, was a popular one that you just did recently. I was away at the time, but those kinds of things, I think, for our group are of interest. And also just funding sources. It may be just a discussion of alternatives. You know, maybe you want to be a foundation. Maybe you just want to be in a better position of receiving grant money, or just perhaps also what kinds of fundings are available for newly formed such community coalitions, and just maybe a little more information, networking kind of thing, maybe a networking day or some of those subjects.
That's an interesting thought, which is, we don't have it now, but having, each CHNA has its own, almost all the CHNAs have their own website, but if there was a way of communicating that kind of information and opportunities to learn more about grant writing or seeking funds, that might be a worthwhile thing. I'm not sure who would coordinate it, but nevertheless, I think that the notion of sort of connecting the expertise within CHNAs is part of the reason for gathering today. It's a good idea.
Andy, am I wrong in saying that you're doing the grant writing for the Taunton CHNA next week?
Yeah, so,
Yes, I thought it was all ready because I was away,
Yes.
but I think one of the members of our MAC group is going to be attending that,
Oh, good,
sharing.
good, yeah.
So,
And Andy Robinson is doing that next.
the organization that was formerly the Southeast Center for, is kind of reinvented itself to some degree, with a little bit more pointed focus on substance abuse prevention. And so we kind of stepped away a half a step from the CHNAs because your work is a little bit broader. But to what degree where any of the CHNAs in the state are working on substance abuse prevention work, we are available as a resource to support that particular aspect of your work. It's a little bit more difficult for us to justify, given our funding streams, kind of the broader kind of effort. But certainly if any one of you or any of your organizations have a subcommittee on substance use or are, through your community-based evaluation and assessment, are identifying substance use as issues in your community that you want to address, we can support you with that. And that's what's allowed us to start working with Taunton kind of on a little bit of a periodic basis. We've offered a couple trainings around strategic planning and now grant writing, but with a kind of a specific focus on how it applies to substance use prevention.
what's the name of your organization?
MassTap.
Oh, yeah.
So MassTap is now the statewide provider. The Regional Centers for Healthy Communities, which used to provide regional support for that purpose, is now MassTap, which is a statewide organization. It's MassTAPP. And we're on the web. I think many of you are probably connected to our listserv. I know a lot of you, and I can carry most of your information forward. If you're not connected, you can probably get connected through your CHNA or your local prevention work. So like the work that Amanda does with DFC. If you have a local DFC, you have a local underage drinking prevention or opioid overdose prevention effort, all of those are connected to MassTap. So you can connect to us through them as well. But also through Ron and folks like Wendy and your CHNA leadership should all kind of know how to get a hold of me at least. And myself and several other staff serve kind of the Southeast region still. So, and then we have a whole team that serves other parts of the state.
I'm the coordinator for GMB Allies. We get a lot of fabulous information from Kathy O'Connor's office, as well as MassTap and other resources. And we try desperately to sort of pull it all together and disseminate it, but wonder what the Inter-CHNA group feels about whether this could be done at a different level. Because if I'm doing it for GMB Allies, I'm wondering about the rest of you, the other CHNAs, how you're pulling your resources together and disseminating it to your members. So it's been sort of an ongoing on and off conversation, but I really think this would be a group to consider how we might best get this fabulous information out to everyone.
Our CHNA has a MailChimp, which will let everybody know when the meeting is going to be. But on that MailChimp, through that listserv, we include information about the MassTap information or about different workshops and things that are coming up. So that's how our local CHNA does it.
Do you have a comment about that?
Yeah. Just that on the Cape, our Barnstable County Human Services does a bi-monthly newsletter that they send out with all the links of anything. But like, I love the stuff I get from Kathy and from you and from MassTap, but sometimes it's overwhelming. And I don't know how to categorize it. Like, what should I prioritize and look at? Because it all looks great, but I don't have time. I mean, some of it is lengthy articles, and I don't know, maybe it is something that the Inter-CHNA could take on in terms of looking at, stuff and deciding what's really pertinent to send out and what, because the other thing is that, like, sometimes I'll get 6 or 7 emails in one day from Kathy. And again, it's all wonderful information, but it's not in any comprehensive format, and so I never know what to do with it. Like, I'll go back through my emails to, like, get rid of stuff that I haven't looked at, and half half of them I've not even had the chance to open yet, and I know it's really good information, but I just don't have the time and the resources, and because some of it's sort of vague, it's just a link, and there's not really anything, it just says this is a great article or something, but I don't know what it's, like how it's connected to me, so.
That's an interesting thought. Get to the second Wendy, but you're right, to have somebody be a filter for that, for each CHNA, to say, oh, this is something that of most importance to the Cape and Islands CHNA, maybe partners in Fall River. Let's make sure that it gets on their radar more than just an email. And it takes a person to do that, and I think the regional centers for healthy communities at the time played a role like that. Go ahead, Wendy.
So that's for our new position of the Inter-CHNA Executive Director, right?
Well,
soon to be funded by, who was that?
Well, I was about to say, there is a determination of need, Community Health Initiatives funding source through South Shore Hospital that has allocated $55,000 for regional support for CHNAs in the Southeast. It's a DON that primarily supports the Brockton and Plymouth CHNAs, but there was a set-aside within that was planned at the time to place funding at the Regional Center, Southeast Center for Healthy Communities, to support at least a part-time staff person to do that kind of work. And that hasn't been decided where or how those funds will be spent, but it's good to know that this is an example of the kind of thing that this group would like to see happen, because I can take that to the table and say, here's a role for a regional Inter-CHNA person who could do that kind of filtering.
Meetings, having something like base camp or something where we could go and look at, materials or, and Andy, didn't we start something like that where we could go in and look at documents and make edits to them and?
Yeah, I mean, we had experimented a little bit with like Google Docs and some of the functionality that platforms like that offer. I mean, there's a million different, now there's Dropbox.
Right. I know one of the groups that I work with does, everything goes through like base camp where, so you're not getting like a billion emails, you're just getting one with like a synopsis of all the material that's available in that location that you could go and look at. The problem with that is it's not categorized. I would like to,
It would be good to archive that as well, because what you look at today may not be relevant today, but 3 months from now, you'd like to find it.
So a couple of things. First off, I used to send them out to every member of the CHNA. Everything that came from you, from Kathy, from Tab, from you guys. And the pushback was so intense that now nobody sends out anything. So that did not accomplish anything. So unless you're on Kathy's list now in Fall River, you do not receive her information. So that's very bad. What we really need is somebody to open up every single thing and write a 3-sentence synopsis and throw it on Google Docs somewhere and give us the address, the URL. So one of the things we talked about was if there is some money here, this would be a perfect job for a student intern, an AmeriCorps member, a Vista person, that is a inexpensive way of getting a full-time person, and the experience and the skill set is something that one of these people could bring to the table. But somebody has to open every single one and say, this is about underage drinking, it comes from this organization, here's the URL to find it on our server.
Well, even just use have a very simple blog that's got certain categories that you all identify as being things that you want to be able to search on after the fact, and then maybe there's a hand.
Right, well, it would have to be searchable. You would have to be able to put in underage drinking and come up with the 35 different articles that were sent out yesterday, about it. But, information is great, but not if people don't look at it. And each of us sent out, my email got shut down a couple of months ago because I had too many sent things in that particular day. Because there's so many that come that they ask you to distribute to the whole community. So I think that if we really want to be thoughtful of what we're doing, we need a much more nimble process, and that is not bombarding people with email after email. People have said to me they see Kathy O'Connor, they just delete it. They don't even look to see what it is because they don't have the time to be able to sit there and read it. And like Bev said, it often comes without any
clue as to what it's about. We don't want her to stop sending us. No, we don't want it. But we want a way to... We want a more nimble way of being able to disseminate that information to our people and have people decide what they want to get and what they want to open. So even if DPH could set up a place on their website that people could visit to find these articles.
No, it's not going to
But
happen.
the DPH website wouldn't work, but we could find a website that could host
Right,
it.
but I think Google supporting it or something.
Yeah.
I think it is a good project for Inter-CHNA to discuss and maybe think moving
it's a good
forward how
project
we
for the
could
state.
manage that.
Inter-CHNA to discuss.
Yeah, yeah.
Right.
But maybe the Southeast develops models or approaches that might work for the statewide group to look at. I think, Jean, you had your hand, and then Mary.
They're all research-based studies, as she says, but, I mean, there could be a meta-analysis done by a student intern. And they would compile all of this data and then succinctly state, you know, what was efficient that might be utilized by the different channels.
I also think a sort of key piece of this is what's the relationship, what's the connection to what an individual CHNA is currently working on? What's their focus, or what's something on the horizon? Because that, having somebody who knows what that connection is and can help to, that may happen within the CHNA itself, where somebody says, oh, this is one we all need to look at, and then
Right, but
forward.
even if your CHNA is not working on that particular issue, you in your, excuse the expression, real job, might be interested in that material too. Very often it's not stuff that Kathy sends, I'll use for United Neighbors rather than for the CHNA. So we want to be able to access it and have it in a searchable way. And like Dave said, I might want this stuff in 6 months from now when I'm writing a grant, and to be able to start saving all this in a way that I can find it again is not possible in the small operations that we have.
Okay, Mary Ann and Barbara and then Mike.
I know, like, for G&D Allies, we've been struggling with that in the last year with our newsletter, and I know Liz has worked really hard to try to categorize items into subcategories so that it would be a much more manageable document in terms of timeliness, whether it was funding opportunities, family-focused, youth-focused, veterans issues. I mean, there are a number of subcategories that we certainly could dedicate. But I think what everyone is saying in terms of being able to archive, to access, and go beyond what we have in our monthly letter, which has really improved a lot, and I think is really helpful if people really read it. But it's not, as a result of Liz's hard work, we're not getting bombarded with all those emails that we were getting before, because she's worked hard to put them in categories and still share that information that's being sent by Kathy. And I think that's been helpful for people that are looking at it that way. But I think long-term, that archiving and accessibility remains an issue.
Yeah. Yeah, because even though I get the ones from the county, the newsletters, then I have to save it.
And where do you save it?
I don't want that. I want to go outside of my computer and my network and go find it somewhere else, where somebody else has already saved it for me. And that might sound foolish, but, you know, I'm ending up looking back like 7 months ago in my emails to find that thing that I think I saw that somebody sent me, and it's totally lost.
Yeah, I think what we're talking about is an abstract. You know, I mean, every research area has abstracts where they're categorized and there's a brief description of it, and you can go back and forward so that, and it doesn't take hours. I mean, Liz is doing a great job, but it's very labor intensive. And then frankly, then I'm trying to find I'm going back now, and I want to go forward, but it's about, 16 meetings back there. So I just think an abstract model, it's been done already for research. We just need to have a place to put it that we could all have access.
Mike,
I
Wendy?
just want us to be mindful of the fact that we do have this statewide Inter-CHNA that is meeting, and that we're planning to do a conversation in the evening after ounce of prevention and the following day of ounce of prevention. And one of the things we said we were going to talk about was what are some statewide advocacy projects that we could use our collective voice to promote. So I want to be mindful that we're already sort of moving towards that. We don't bite off more than we can chew.
Yeah, some important concerns have been raised here about, okay, who's going to do this work? because it does involve a lot of work. We've already demonstrated that we've got a lot of investment of people's time in making our events successful. But to carry on an initiative, and maybe there is some strength in working statewide on this. Liz, you had your hand, then we'll go to you, Marion.
Oh, no.
Okay, Marion?
Well, I think going back, I was thinking along the same vein in terms of policy and voice that we want to give to the CHNAs, that we have made lax in the past because we're coming together and strengthening that voice. And policy advocacy seems to be a very good place that we could work together. And I think one of the things that we have is we have tremendous assets when we look at all the different CHNAs and experiences that they've had, best practices they've already established that they can share, that we can build on. There's no reason in some cases to recreate the wheel. Maybe redefine it a little bit and expand on it in ways that are more appropriate depending on the service area that you have. But one area, for example, that people are starting to hear me talk about that I think is very important is the issue of Lyme disease. Others have talked about it before. There's pending legislation that we could get behind. It's a matter of social justice. It's a matter of health equity. There's wonderful work being done on Cape Cod. There's wonderful work being done in Sturbridge, Mass. I understand there's some work being done in the Boston area. And we have more cases in Massachusetts of that being reported than any other state in the nation. So, and it's underreported. And the sequelae of not treating it in a timely fashion is really affecting neuromuscular systems of people of all ages. And they're comparing it in some of the information you're seeing. It's an epidemic that could be comparable to HIV because they're even looking at it being transferable from mother to infant. So, how are we looking at that? How is that affecting other things in terms of autism and education? I mean, there's so much research that needs to be done. There's a lot of advocacy that can be done on many different levels. But I think that's some of the things that we're going to need to talk about at the statewide area. But in the Southeast, these may be specific things that we want to, because of the amount of concern that we may have. Or for some of us, as we know from what Andrea said, if it's personal, it really makes a difference. And for a lot of people, this is personal. So I just want to share that with you, that's one of the things that I think is important. And there's legislation pending that's been in session for several years that hasn't gone through. And it's about requiring all health insurances to provide long-term antibiotic therapy if there is an issue of clinical findings by a physician. And fortunately, there's been legislation that's been passed to protect physicians for prescribing when they feel it's necessary, when in the past they were not protected and could have lost their license. So I think there's a lot of interesting things going on, and that's one thing that I think you can see I'm passionate about. But I think our potential, our collective voices, Wendy said, could be phenomenal statewide in terms of, raising issues that we really want to get behind. And if it's one issue a year that we tackle, or over a few years, but we get there, that sense of accomplishment fuels future efforts.
You've talked with our policy communications director about that, and we want to, try to, when we hear that there are other issues around the state, that another community or region or several CHNAs are together, it makes an impact on whether we think we can help advance that. So, by letting us know what these issues are, that the more people, the more groups, the more CHNAs that say, hey, we agree that this is a top priority, that tells our board, oh, hey, look at this.
I also think we spoke about, to shift slightly, getting some more training, and Andrea, I would look to you and your organization for this, on how to write advocacy papers, how to respond to editorials in your local paper, or if you go on the radio, how to have a clean and efficient voice and have the CHNA sort of decide on the issues that are the most relevant for their community. So how do we craft that information so when the tobacco in the pharmacy goes into your newspaper, you can immediately respond in the appropriate way without waiting for next month when your CHNA meets, and by the time the letter gets there, everybody's forgotten what the issue is. So I think that we should keep that in mind as something that we talked about learning more about. 4 times, right. So right now what we're focused on is putting together this day and a half, and one of the things we will do at the day and a half is to try and figure out what people would like to put their collective voice to. Everybody keeps on throwing out things, and we keep on saying we're not there yet. First, let's get together. We want to share a little bit about what everybody's doing, best practices. We're cognizant of the fact that every CHNA is different, but the underlying themes that connect us are those general health and wellness issues that we pretty much all advocate for. Some of us might, be doing violence prevention work, some might not, but there are some core things like health equity came up, access to health care, those kind of things that we think all of us are touching on. But I think that part of this day and a half is to explore what people are interested in pursuing and what's going to light your fire.
It's hard work getting to that point. It's hard, but once you're together on it.
And we'll have a really big voice. Because when you think about it, it's not just the voices of the CHNA. The CHNAs are made up of a variety of different organizations. And those of us that sit on a CHNA now are the conduit to our home organization, for lack of a better term, to bring that information back and fire them up and get them involved. And that could be really powerful.
P.S. You've got the Senate President, Plymouth. That's
huge, huge.
Francisco?
Yeah, two resources that we would like to also offer. One is Healthcare for All is developing training materials with regards to the Affordable Care Act as it comes in Massachusetts in 2014. And part of these trainings that we're putting together are in-house trainings for staff of service providing organizations. So if you're interested in that, please let us know and we'll be happy to go and visit you and talk to you about this possibility. The other possibility has to do with public policy. We're developing a training of sorts, but it's more for community residents, for consumers. So, but providing services sometimes allows you to identify consumers that are potential leaders in the communities. And so if, when and where this happens, maybe we can connect so that these leaders, these consumers, community residents can be trained and then work in collaboration with your organizations pushing issues at the state level.
What is your organization?
Healthcare for All?
Oh, okay. Is there a website?
Yes, www.hcfama.org.
Okay, it's close to 11:30. I think we're going to wrap up here. When we were planning this in February meeting, we realized it was a great opportunity to acknowledge the work of one CHNA in particular, although this is about all of the CHNAs. But at that meeting in February, our colleagues from Partners for a Healthier Community in Fall River was down in New Jersey receiving the Roadmaps to Health Prize, one of 6 recipients in the country to receive that. And we felt it was important at this to celebrate their success in doing that, because when you look good, the entire system looks good, and we're all of the CHNAs here in the Southeast are great, very committed groups, but we thought we'd be remiss in not acknowledging. So if the folks from Fall River CHNA could stand up, offer a round of applause to them.
Somerville was a runner-up. And this is across the country. So this says something about what's going on in Massachusetts.
So there's something in my statement that was going to be something like, while you may be one of 6 in the country for that, you're one of 6 here in the Southeast among the CHNAs. So there's something there in that. That I couldn't think through any better than that. But thank you all. I'm glad you all came this morning, and we'll see you next time. Thank you.
That's a nice bag.
Starting to wear out.